Hi, welcome back again. It's Laura from Front Office Rocks, and thank you for joining me on our wonderful YouTube channel. And I'm going to talk about the idea of needing more new patients. I hear all the time from doctors and team members and when I'm out speaking about how we need more new patients. How can we get more new patients? And I think it's great. I think that more new patients is awesome. And I believe the reason that marketing companies are popping up all over the country trying to help dentists is because we're really trying to get more new patients, which is great. I think that new patients are important. I think we need to grow our practices. I think that they're fun. It's great to be recognized and people coming to you looking for a new dentist. And I think that's awesome. But here's what I'm going to tell you. We need to stop focusing on just more new patients. I work with Dental Intel is one of the companies that I work with, which is a metrics software where we can see actual statistics of what's going on in most of the dental offices in the country. And the issue that we have in most of the dental offices in the country is not needing more new patients. Most practices are getting a sufficient number of patients, hopefully. But the problem is we have a backdoor issue, which basically means we're losing more patients than we're getting. So let me just explain that real quick. I'm not going to solve the problem in this video, but I just really want to break it down because if you're looking for more new patients, that's great. But I would suggest you actually dig into your numbers a little bit, whether you work with Dental Intel or whether you do this with another software or your own practice management software. Really start looking at what the real issue is. So the real issue is potentially that you're losing more patients than you're getting in. And what I mean by losing is that the patients are not scheduling their next appointment, not coming back for their next appointment. They're basically not being seen by you for a certain period of time. In our industry, it's considered 18 months. So after 18 months, if a patient hasn't been seen by your practice, they're considered inactive. Now, let me say right here, do not mark them inactive in your practice management software. Just because they haven't been in 18 months doesn't mean they're not coming back. So if we mark them inactive, you won't get them on lists and you won't see that they haven't been in. So you want to keep them active in the practice until they truly are inactive in the practice management software. But the issue is they haven't been in your practice in 18 months, and that's too long. That is where we really need to focus. Now, there's multiple reasons why patients haven't been in the practice. Most of the time, it's just because they got busy, they didn't schedule the next appointment, they canceled their appointment, life happens, and they just haven't been in 18 months. That's the typical reason. There are other reasons, right? And if they truly did move or pass away or get in and go to a new dentist, then those are truly inactive. But what we need to focus on is where are the patients who've disappeared, who aren't gone, who haven't really moved or gone to a new dentist. They're just not in the practice. Go look at that number, and I bet you will find in most cases that the patients who are going inactive, meaning it's been 18 months since you've seen them, there's more of those every month going inactive than you are new patients coming in. Now, that's a good problem to have. That's a good thing because you have full control over that. What that means when you're losing patients going inactive or it's been 18 months since they've come in is that they just haven't been reminded why you're amazing and why they should come in, or you don't have the right systems in place and verbal skills to get the patients in for their appointments, get them to reschedule when they're there, get them to get their treatment done. That's something that we can work on and we can fix. Getting more new patients, you can do that too, but that costs a lot of money. It takes a lot of energy. It takes a lot of marketing. It takes a lot of online Google ads and all that fun stuff. We can do that, but while we're doing that, what if we focus on the internal things? Let's look at things like how good are we at reappointing? How good are we at getting patients to get their treatment done? How good are we at case acceptance? How good are we at customer service? Those are things that you fully can control, and you've already paid for that new patient to become a patient of yours. They've already picked you. Let's find and fix the things to keep them in the practice. So you hear about this a lot when you're actually digging into the numbers of your practice, but a lot of times we don't know what to do about it. That's why I have Front Office Rocks, because honestly, you can control how your patients are treated, did they reappoint, how we do the schedule, how we run our systems, how great is our customer service. So if you're here to look for more new patients, and I kind of teased you with this being a more new patients video, great, go get more new patients. I'm not saying don't do that. But what I am saying is instead of spending so much energy on getting more new patients, let's stop and let's look at what's really going on in your practice. We can help you with that at Front Office Rocks. There's a lot of great resources out there to help you look at it, but spend some energy and time looking at what's going on in the practice and your backdoor problem before you throw a lot of money, time, and energy on your front door and getting the new patients in. Again, I'm Laura from Front Office Rock. So if you have questions or you want to talk about this topic more, let me know. Reach out to my team. We can help you with this and really kind of balance the interest and excitement about new patients with keeping the patients that you have in the practice, because that is really how you're going to get your practice to grow. So thanks for listening. Write comments down here below. If you have any other questions, subscribe. And until next time, I'll see you then.